Sensitive topics like abortion, maternal health care, and teenage pregnancy often go underreported despite their significant impact on public health. Then you start saying, how many girls are dropping out of school? Roughly 1 in 5 pregnancies ends in induced abortion, often performed illegally and unsafely. Teenage pregnancy rates are also alarming, with 25% of girls aged 15 to 19 reporting pregnancy and 18% of these pregnancies occurring annually. According to Dr. Betty Chadondo, the burden of disease is high.
The things that I should mention: burden of disease in Uganda is almost 90 or even more percent preventable. Okay, so why are children dying during birth, just before birth, during birth, or immediately after birth? There could be different reasons. The common ones is the problem because of a mother. Also could be the conditions under which the mother is giving birth. Is the mother giving birth in a safe and secure environment? So in terms of hygiene,
Bakshi Asman, an SRHR practitioner, attributes this to misconceptions and false narratives surrounding sexual reproductive health rights.
Contraceptive access by young people and majorly teenagers will increase them having sex. But what we know is when a young girl or young boy has access to information, when they have access to services, their chances of getting pregnant is low. We have seen narratives like, for example, abortion is murder. Yet we all know that, for example, the Constitution of Uganda restricts and gives provisions on access to abortion. So it has to be in a restricted environment by a qualified medical health worker. We have seen narratives like, for example, sexuality education leads to young people having sex while they're young. But this is access to information. The more the young person is empowered, the more they are able to do that. But also we have seen narratives around sex workers and how they are promiscuous and how they spread HIV. But we have seen studies that actually show that high HIV prevalence rates among the marrieds.
These narratives, driven by cultural and societal beliefs, undermine policies and limit access to essential services.
For a very long time, we have seen narratives that are being framed from the religious and the morality aspect, frames that are being framed from the political and the legal and the judicial rulings, but also frames from the human rights organizations that speak about the different human rights violations, and frames that are framed around the different emerging narratives that the day-to-day we speak about: context, technology, the politics, and all that. So some of these narratives affect how SRHR indicators happen. For example, when it comes to access maybe to contraceptives, a given narrative can come out and say, maybe from a morality perspective, that my religion, my culture does not allow me to access a contraceptive.
This is where the media comes in. Organizations like Palladium led a program called Women's Integrated Sexual Health and Health Journalists Association (HEGIM) are empowering journalists to prioritize SRHR reporting and equip them with fact-checking skills.
Mostly to empower journalists in the way they report on SRHR. And we have heard and we know that many media people are in communities where so much information that is not true, or misinformation, or even disinformation that is being spread deliberately is happening about SRHR.
The main aim of this project is to ensure that there is a conducive environment for women and girls to access sexual reproductive health and rights. So the conducive environment looks at both the policy but also the financial environment. So why are we interested in working with journalists? We know that journalists are the voice of the voiceless, especially for the communities, but also they are a voice for so many things that are happening in our healthcare system, which we probably don't talk about.
Esther Nakazi, founder of HEGIM, explains that this initiative aims to debunk false narratives and promote accurate information on SRHR, ultimately improving public health outcomes.
So the training that we are having today, or that is going on right now, is to help them understand and to help them report better, and to help us, because I'm also a journalist, to help us to better our society by giving factual information, debunking things that are not true, and providing clear messages that will help shape our communities.
Terina Naguja for NSTV.